We are back here on Healthy Living. I'm here with Dr. Thomas Newton, and we are at Coastal Carolina Hospital at the Center for Hyperbaric and Wound Healing.
That's correct.
Is that correct?
Yep.
Now tell me a little bit, if you will, about wounds, about why there needs to be a specific center for wound healing, and then about hyperbaric chambers.
Sure. Well, we do a couple things really here at the Center for Hyperbarics and Wound Healing. Our main focus really is on the hyperbaric medicine part of it. And what that really involves is medical treatment whereby the patient breathes 100% oxygen in one of the specially designed chambers that you see behind us. And as a result of that breathing of oxygen under pressure, we see a 10 to 15-fold increase in the amount of oxygen that's concentrated in the bloodstream.
Now why? Is it just simply, well, let me ask you not the why, but why is that important for wound healing?
Well, it does a number of things. There are a number of conditions that have been approved by Medicare and the Undersea Hyperbaric Society to treat with hyperbaric therapy. And those things include such things as diabetic ulcers, and I can discuss some others a little bit more. But there are a number of benefits to breathing 100% oxygen.
You know what I think about when I think of hyperbaric chambers is being a PADI diver, being a scuba diver in bends and things like that. Is that how it all began?
Well, that's one of the ways it began, certainly. Actually, this hyperbaric medicine has been practiced for probably 50 plus years, and there were a lot of sort of thoughts initially on how hyperbaric medicine worked, and that certainly has been refined over the years. Some of the effects that we see include just the increased amount of oxygen going to tissue, which helps to support tissue that otherwise might fail due to a lack of blood flow.
Okay, now what does that mean in layman's language? For example?
We see conditions whereby, say for example, a crush injury to a hand or to some extremity, where the extremity might be compromised because there's not enough blood flow going to that body part. So that's an indication to go in a hyperbaric chamber. Breathing that 100% oxygen under pressure causes the diffusion of oxygen that allows that part and that tissue to remain viable until you can establish a new blood supply.
If tissue is dead, it is dead. But if it is compromised, that is then the opportunity to take advantage of something like this?
That's exactly right. And we see that in a couple of different cases. Crush injuries are certainly an example of that, but we see it in other conditions where there's poor supply to a given part. Say example, for bone or tissue that's been damaged by radiation. That's an opportunity for hyperbaric medicine to play a role in healing those areas.
So specifically, if someone has a cancer or...
Usually this occurs after the cancer has been treated by radiation therapy.
Okay.
And as a result of that radiation therapy, there's been some residual damage to the tissue.
So healthy tissue has gotten burned, if you will.
Right.
Okay.
Other things that we see is people who maybe have a severe anemia where they can't get blood products for one reason or another. Hyperbaric medicine can be a temporizing measure for those type of people. Carbon monoxide poisoning is an indication whereby the hyperbaric oxygen actually inhibits some of the toxic effects of the carbon monoxide.
You talked a little bit about diabetic wounds. Now tell me about that and how the hyperbaric chamber helps with that.
Usually we treat more complex diabetic wounds with hyperbaric therapy, and those are usually diabetic wounds that are infected, either have a deep abscess or infection that's now gotten into the bone. One of the other benefits of hyperbaric therapy is what we call an antimicrobial effect, which means that the hyperbaric oxygen actually kills bacteria or can inhibit the toxins that are produced by those bacteria. So another indication, for example, might be gas gangrene or the necrotizing soft tissue infections that you see sometimes that can be quite severe and life-threatening.
How does someone come to you? Are they referred by another physician or?
Well, that's one way, but actually patients can call us directly.
Directly? Okay, all right.
Or they can be referred by their physician. In either case, we really like to keep the primary care physician involved in the treatment plan here. But they can call the hospital or the center directly.
One of the things that I'd really like to know is exactly, not so much how it works from a medical standpoint, but what a patient is likely to experience if they come for wound treatment.
The chambers actually are designed with a bed that you can see that can be adjusted, so the patient can sit comfortably in the bed.
Okay, all right.
The bed can be adjusted. You can move around in the chamber. You don't have to lie still at all.
Have you been in there before?
I have.
Okay,
Yep.
all right.
And as you can see, it's clear acrylic, so the patient can see around.
So claustrophobia, not so much.
No, you know, people are a little bit anxious the first time or
Right.
two when they go in there.
Like
but that's
TV.
it. Right, exactly. Exactly. But there's a hyperbaric attendant that sits chamber side with all of our treatments.
Okay.
And so that person is, you know, readily accessible to talk to the patient. The main thing that most people feel is the changes in pressure that occur when we're either pressurizing the chamber or after the treatment is completed, where we're reducing the chamber.
What does
and
that
usually
feel like?
that involves a sensation or pressure in the ear,
Oh, like
similar to what you
airplane.
might experience
Yeah.
while flying. Certainly.
Okay.
Other than that, there's really nothing else different that you would otherwise feel.
How long do the treatments last typically?
Usually last about 90 minutes, and we do the treatments daily, 5 days a week.
Oh, really? Okay.
And so in some emergency cases, for example, the carbon monoxide poisoning, it may only require a couple treatments, and then there are other conditions that may require 20 up to perhaps 60 treatments in the chamber.
What are the most challenging conditions that you all treat here, or I don't know if challenging, but typical?
The conditions that we usually treat with hyperbarics usually involve bone infections that aren't responding to antibiotics, what we call chronic osteomyelitis. Then there's the problem diabetic wounds that have infections. We commonly treat skin grafts or flaps that have been performed that aren't healing properly.
Oh, interesting.
And then, of course, bone or tissue infections caused by radiation damage. Now, the other types of conditions that can be treated include the carbon monoxide poisoning we talked about,
Right.
severe anemias, diving accidents, decompression illness, and occasionally some acute burn care, but usually those are handled in a burn center.
We're going to take a quick break, and we're going to come back here on Healthy Living and talk more about wound care. Stay
Very
with
good.
us. We'll be right back with Dr. Thomas Newton.
These hands hold tight. These hands love. These hands support. These hands create. These hands save lives. To empower your hands to help make a difference, call the American Heart Association at 877-242-4277 for a CPR class near you. These hands are wise.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
We are back here on Healthy Living. We're speaking today with Dr. Thomas Newton, and we're talking about wound care. And one of the things that we chatted about really during the break is, what is chronic wound care? what are some of the treatment options available, and how do you treat a wound over time?
Right. There's a little bit of a different definition of chronic wounds depending on who you talk to. Some might define a chronic wound as a wound that hasn't improved significantly or healed within 4 weeks.
Okay.
Now, we tend to be a bit more aggressive and tell people if they have a wound that hasn't shown significant improvement in a couple weeks to come and see us.
Now, and not to be a dum-dum about it, but what does significant improvement look like? What are some of the things that I should pay attention to if I do have a bad wound?
Right. We tell people that if they haven't seen improvement of about 50% in the size of the wound, then that wound is not progressing normally.
Okay.
And they should give us a call.
Should wounds be covered, uncovered? I guess it depends if it's a diabetic wound or an ulceration. Or...
Right. It depends upon the type of wound, and we see all kinds of wounds. I mean, we deal with pressure ulcers, which are like bed sores.
Bed sores, okay.
The diabetic ulcers. We see ischemic ulcers, which are ulcers due to lack of blood flow to the area. We deal with venous stasis ulcers, which are ulcers that usually in the legs that are due to swelling or accumulation of fluid.
Are there any times that you would do hyperbaric pressure for something internal as opposed to external?
Most of the internal conditions that we would treat are typically probably related to the radiation,
okay,
such as
all right.
radiation,
So
esophagitis, or problems
gotcha.
with the bladder related to
Okay,
radiation damage.
so the answer is yes, but going back to the chronic wounds, other kinds of wounds that you do see. I mean, do you see lacerations that aren't healing? Do you see
We sure do.
cellulitis?
And our staff really specializes in treating all types of wounds. So we see people who've gone out and bumped their leg on a car door or a dishwasher. It's just not healing properly. And so we're happy to assist really with taking care of all types of wounds. And there are some people who frankly don't know what the wound was caused by. All they know is it's just not getting better. So.
Are you genetically predisposed to being a fast healer or a slow healer? Are there people that are specifically inclined to need wound care?
A lot of what we see with problems with wound healing are usually related to underlying medical conditions. So if somebody is a diabetic, they're not going to heal quite as well, not only because perhaps their blood sugar is not well controlled, but they have diabetic neuropathy, which means they can't sometimes feel a wound on their foot. And so it just gets worse because they don't know it's there.
How does that actually present? Literally someone would cut their foot and just...
And not know it.
Oh, really?
Right.
Okay.
Yeah. Until it perhaps gets infected and starts to drain or something happens that would let them know that they have a wound.
Now, once someone does come in and has the treatments, is the ultimate goal complete healing of the wound? And are there other therapies that are used at the same time that you're doing the hyperbaric therapy?
Right. We like to follow our patients until the wound is completely healed, just because we find that as a wound progresses through the various stages of healing, that there can be problems at various stages, and we like to be able to track that. Not only do we deal with advanced dressings that used to heal the wound, but we also provide just patient education, education to family members on how to care for the wound. Ulcer prevention once the wound is healed, how to take care of the swelling in the legs, the venous stasis once we've healed the wound there. So.
What kind of training do you have, and does your staff have specifically for wound care, or that's necessary for wound care?
Yeah. All of the physicians and staff here have undergone specialized education, both in hyperbaric medicine and in wound care. And I think the important thing is that we require of all our staff ongoing training, so that if there's any advancements in the field, we're implementing them into our treatment plans.
And that actually brings me to my next question, which is what kinds of advancements are you seeing on the horizon? What are we looking at it as far as hyperbaric medicine, wound care medicine?
As far as the field of hyperbaric medicine, really there's a number of areas of sort of investigational study that are occurring right now. There's probably about 15 indications right now that are currently approved by Medicare for hyperbaric therapy.
Okay, and those would be?
Those would be things such as the complex diabetic ulcers, carbon monoxide poison that we talked about, the severe anemias, the bone infections, crush injuries. Those are some of the indications.
And those are used now as gold standard.
Right, those are indications where there's been scientific proof of the efficacy of hyperbaric medicine.
Okay.
So, you know, we like to consider hyperbaric therapy similar to giving somebody a drug. I mean, the oxygen is the drug, the chamber is the delivery system. That's how we provide the
How
therapy.
does it actually work? When I get into the chamber, am I surrounded by the oxygen? I noticed that there's an oxygen mask there.
Right, there's a couple.
Atmospheres.
Right, there's a couple different types of chambers. We have what are called monoplace chambers, which means they're designed for a single person. There are actually multiplace chambers where 6,
Group.
7, or 10
Yeah.
people can go in for a dive, and they usually breathe oxygen through a hood of some kind. In this chamber, the 100% oxygen just circulates in the chamber, and it's that what we call systemic delivery of the oxygen to the tissue that has
So
an
I'm
effect.
breathing in,
so you
breathing
can't
out.
stick your leg in just
Okay.
a hyperbaric
Okay,
thing
right.
and expect the oxygen to be absorbed into the area.
Okay, I have to be
Yeah.
I have to be contained in it.
Right, you have to be contained in it and breathe it in.
So why would I need an oxygen mask?
Well, actually, the mask that you see is hooked up to air, and there are some people who are prone to some side effects, perhaps, of breathing a high percent of oxygen for a long period of time,
Good side effects or bad side effects?
potentially bad side effects.
Okay,
So as a result, what we do is we give them what are called air brakes. So if they show any indication that they might be more sensitive to the effects of the oxygen, have some side effects, then we give them a break halfway through the treatment, let them breathe some air through the mask, and that helps to prevent any side effects from occurring.
Mechanism of action is known. We know why it works.
We know why it works. And again, it goes back to increasing oxygen in the tissue, killing bacteria off, helps to reduce edema to areas.
Edema, okay.
That may be important, for example, in somebody who's just undergone a skin graft or flap, where there's already sort of a poor blood supply to the area. If they start to develop swelling, that can affect how the graft might do. So breathing oxygen actually causes constriction of the vessels without reducing oxygen, and that helps to reduce edema.
It's actually a fascinating medicine, isn't it?
It is a fascinating medicine.
And are there advancements on the horizon? Are there things that we are looking at for evidence that?
Well, there's a number of things that are being looked at with regards to hyperbaric therapy.
Well, I always
One
hear
of them is
memory.
well, there's that, and there's also an interesting one is the area of what's called reperfusion injury, where after somebody has had, for example, maybe a stroke or a heart attack, there's an area of tissue, you know, that may be sensitive. If we reintroduce blood flow to that area, then it may not do well. So hyperbarics is being looked at in those type of circumstances to help with reperfusion.
Of course, I was going to ask you, you know, he's talking big things. I'm thinking wrinkles, memory.
Well, it perhaps can have a beneficial effect for that, although it's hard to get insurers to pay for that.
Yeah, doggone it.
Yeah.
Well, we really appreciate you taking time out of your day. It's really fascinating, and it's always fun to actually be able to come in here and see what you do. Thank
We're
you
happy to
very
have
much.
you.
And
You
I
bet.
know from a referral point of view, you can self-refer if you have a wound. We'll have your phone number up here, and
Right.
Dr. Newton,
And again,
thank
if you have a wound that hasn't gotten better in a couple weeks, give us a call.
Thank you, sir, very much.
Okay,
Thank you all
thank
for
you.
joining us here on Healthy Living. Bye-bye now.